Hi everyone, this is Stacy Reynolds, and in this video we'll be discussing how to format a manuscript. Key documents included in a submission to a journal often includes a cover letter, title page, abstract and keywords, text and references, and tables and figures if applicable. In this video, we'll cover information on the manuscript itself. First, we'll discuss the abstract. Including an effective abstract is helpful because outside of the title, the abstract is generally the first thing that readers will review. I like to think of the abstract similar to a movie trailer, where you want to include a short overview of the entire manuscript and not focus solely on one point of it. You'll need to review author guidelines to see what the word limit of the abstract is. Some abstracts are as short as 50 words or up to 500 words. So it just depends on the format required by the journal. A common way journals request abstracts be formatted is through a structured approach, where specific headers are used to organize the abstract. Example headers may be something like background, purpose, methods, results, and conclusion, but again, it depends on the journal and what they require. Another format is an unstructured abstract. In this type of abstract, headers aren't used, but rather the manuscript is summarized using a short paragraph. Here's an example of a structured abstract, where headers are used to organize the information under background, purpose, methods, results, and conclusions. This abstract is relatively short and was limited to 150 words. Here's an example of an unstructured abstract that was limited to 50 to 75 words. Here you can see that there are no headers, and it reads more like a short paragraph about the article. Journals may also request that you provide some keywords. Keywords are important because they are used to index, categorize, and increase the searchability of articles. When able, it's recommended that you include mesh terms or medical subject headings to help with indexing. The keywords should ideally not repeat terms that are already in the title or abstract, but rather include other words that readers might use to search for your article. The keywords and mesh terms that you include should be frequently used terms in the manuscript. Before we go into formatting the manuscript itself, I wanted to briefly mention reporting guidelines, which are checklists that help guide authors when they write manuscripts to ensure all necessary components are included. When reviewing the author guidelines, you may find that journals recommend or require the use of reporting guidelines. Some journals may even require that you upload the reporting checklist documenting which page in the manuscript includes each criteria. A comprehensive list of reporting guidelines can be found on the Equator Network website, or there may be specific ones listed in the journal's author guidelines. Some examples of reporting guidelines that may be helpful for your project include those focused on EBPQI, program evaluation, or policy analysis. There are also specific reporting guidelines for QI, qualitative research, randomized trials, and systematic reviews. Even if reporting guidelines are not required by the journal, you can still review them as they can help organize your content. It is important to note that author guidelines supersede reporting guidelines in terms of things like formatting and headings to use. Additionally, if you use a reporting guideline, make sure to cite it within your manuscript. Now let's dive into formatting your manuscript. Most manuscripts will include 4 main sections and follow what's known as an IMRAD format, which stands for Introduction, Methods, Results, and Discussion. In the following slides, I'm going to provide examples of what information may go into each section for a QI project, but this may differ depending on the type of project you're doing. The introduction often helps answer the question, why did you start? The introduction is where you'll describe the broad problem and background information, such as incidence and prevalence of an issue, as well as the gap or problem that your manuscript addresses. This section often ends with a formal purpose statement, as well as the manuscript's aims or objectives. I'll provide very brief examples of what type of information may be presented in each section. In this example, the authors state that CLABSIs are a preventable patient harm and that CHG bathing helps reduce CLABSI risk. This provides the broad problem and background. In this section, authors may also include broad data about the problem of CLABSI, such as the prevalence or cost. Next, authors provide information on the local problem, showing that CHG bathing compliance was low, patients were refusing baths, and CLABSI rates had increased. Next, the authors provide a formal purpose statement for the project, which was to implement a CHG bathing protocol, and the aims were to increase CHG bathing compliance, reduce patient refusals, and reduce CLABSI rates. The introduction helps lay the foundation and build the case for the methods that you used. The methods section helps answer the question, what did you do? It's really important to be detailed in this section because if others want to complete a similar project in their own setting, they need to know how you completed the project. Typical information that is provided in the methods section includes the design of the project, the setting and sample, details about the intervention or procedures that were carried out, and how data were collected and analyzed. Continuing with our CLABSI example, our design may be iterative PDSA cycles used with the QI project. The design should describe how the project was conducted, if it used a QI design or pre-post quasi-experimental design or qualitative design, whatever was used for your project. The setting describes things like the geographic location where the project took place and the specific type of unit or hospital. In this example, the setting was 4 ICUs at an academic medical center in the southeastern U.S. For the intervention or procedures section, it's important to include specific details of what you did to allow others to replicate or translate your intervention to their own setting. Here I have just a short sentence about the standard protocol that was developed, but this would be much more in-depth in a manuscript. Next, you would describe how data were collected. For this project, we can see data were collected from EHR audits and CLABSI rates had a standard definition. For the analysis, you would describe how data were evaluated. In this example, they were evaluated using run charts. Lastly, somewhere in the methods section, you may describe ethical considerations, such as IRB approval. For this example, we see that the project was approved by a QI committee. The next section is results, which helps to answer the question, what did you find? This is often a shorter section and simply reports results from your analysis. Here's an example of the results section. Here I have a short description of the signals of improvement identified on the run charts, along with the baseline and post-implementation medians. You can see that for the CLABSI rates, I've also noted there is a figure. For some outcomes, it may be helpful to include a figure or table to visually display the data. Here's an example of the figure where each PDSA cycle has been annotated. You should note whether the journal accepts figures in color or only black and white. Be judicious in your use of tables and figures. As many journals have a limited number of pages, the number of tables and figures may also be limited, so check their author guidelines. Only include figures and tables if they substantively add to the manuscript. The last main section of a manuscript is the discussion, which helps answer the question, what do the results mean? In this section, authors generally provide a broad overview of their findings and how their results compare and contrast to other evidence. This is where you can also interpret your findings and describe implications for practice, along with the potential for spread of the initiative. The discussion generally ends with a short paragraph listing the limitations of the project. Finally, the manuscript ends with a formal conclusion section. This should be a short paragraph that summarizes the article. No new information should be added into this section. Rather, it is simply a summary of the article. Here's an example of a discussion section. I may begin by broadly providing an overview of our findings, such as We saw improvements in CHG compliance and a decrease in patient refusals and CLABSI rates. Then we would compare and contrast these findings with others in the literature. So, were our results similar to or different from other articles that completed similar projects? It's helpful to provide an interpretation of the findings and implications, which should be geared towards the readership of the journal. So for those reading the article, what should they do with the information? Lastly, the discussion section includes a limitations paragraph. This may include things such as the project being completed at one particular hospital, which may limit transferability of findings. Following the discussion and conclusion sections, the references are listed. Check the author guidelines to see what reference format is required. Often this may be either APA or AMA formatting, but the journal may require a different format. I highly encourage using reference management software such as Zotero or EndNote to help organize your references. Using a reference manager can also help you if you need to reformat your manuscript to a different journal. For example, let's say you submit your manuscript to a journal that requires APA formatting, and it unfortunately is rejected. You decide to submit your manuscript to a different journal, but they require AMA formatting. If you used a reference manager, changing your references from APA to AMA is very simple. You can do it with just a click of a button. If, however, you formatted your references manually, updating from APA to AMA can be a very tedious and time-consuming process. So save yourself the hassle and use a reference manager from the very beginning of your project. Here's an example of AMA and APA reference formatting. The first one is AMA, where the in-text citation is a superscript number and references are listed in the order in which they appear in the manuscript. The second example is in APA formatting, where the in-text citation includes the author's last name and year of publication, and references are listed in alphabetical order. You can see that AMA formatting can save space, and because of this, many journals use AMA formatting. Again, it's very important to review author guidelines to see how journals want references formatted. You may also include tables and figures in your manuscript, which can help provide a visual for your data. There will likely be little to no editing of tables and figures, so they need to be submitted as if they were ready to go to press. They also need to be able to stand alone, meaning that it is self-explanatory and readers can fully understand it without referring back to the main text. As mentioned previously, check to see if the journal has a limit for the number of tables and figures they allow, as well as if there are specifications that need to be followed, such as whether the journal publishes in color or only black and white. It can be helpful to review other articles published in the journal to see how tables and figures have been formatted. Again, only include them if it will add to the manuscript. As a general rule of thumb, if the information can already be found in the text, a table or figure may not be needed. As mentioned, tables and figures must be submitted in their final format and ready for press. As such, make sure that you're following best practices for visualization, especially with figures. This includes things like making sure everything is appropriately labeled. For this run chart, this would include labeling the title, axes, and legend. In this figure here, there are several issues, and it is not ready to go to press. First, the title is not descriptive enough to stand alone. Readers are not told if this is the average daily census of a unit, or hospital, or health system. The axes titles aren't labeled, and the months on the x-axis have been cut off, so it's unclear what years are being reported. Additionally, there's no legend, so readers are unable to know what the yellow line is referring to. This is an updated version of the figure, which includes a descriptive title, as well as being labeled as Figure 1. The axes titles are also labeled. The month and year are both visible on the x-axis, and a legend has been added. This figure would be ready to go to press. So before you upload tables and figures, make sure to review them thoroughly. As you begin writing your manuscript, it can be a little daunting, so I'll provide you with some recommendations to consider. First, start with an outline of section headers, including the introduction, methods, results, and discussion to help organize your document. For your first draft, write fast with a goal of just getting words on the page. Don't worry about grammar or sentence structure, as you can revise this later on. Also, sometimes staring at a blank Word document can be intimidating if you're unsure where to start. However, I find that while people may not know what to write about their project, they are often able to talk about their project. In this instance, enabling your dictation tool can be helpful, and just answer these questions. Why did you start? What did you do? What did you find? And what do the results mean? While this approach will require editing, this at least helps you get the words on the page to begin the manuscript writing process. To recap this video, we discussed developing structured versus unstructured abstracts, how to identify keywords, and what reporting guidelines are. We also reviewed core components of a manuscript document, including the introduction, methods, results, and discussion. And we ended by describing different types of reference formatting and best practices for including tables and figures in your manuscript, along with some writing tips. Thanks for watching, and I'll see you for the next video.